Hello, everyone. So my name is Skylar. I don't know if you guys want to introduce yourselves, but
I'm Chris.
I'm Miguel.
and this is our infectious disease group project presentation. We did it on HIV and AIDS. Next screen, please. Okay, so this is our table of contents. As listed from 1 to 7, we'll be doing introduction, disease, agent, symptomatology, prevention and intervention, treatment, disease distribution, and conclusion. All right, so starting off with introduction, so this is HIV, human immunodeficiency virus. It's a virus that weakens the host immune system and attacks the immune system, specifically white blood cells, and more specifically to that is the CD4 cells. And so when enough CD4 cells are destroyed, it actually leads to late stage HIV, otherwise known as AIDS, acquired immune deficiency syndrome. And so this is a chronic condition that is life-threatening, and like I said, it's the late stage, and the factors for it is that CD4 cells fall to less than 200 cells, and just overall, AIDS is the name used to describe a number of potentially life-threatening infections and illnesses that happen when your immune system has been severely damaged by the HIV virus. Next slide, please. So this next be disease agents. Next slide. And then, so I'm going to be discussing family, genus, and the overall structure of HIV. So the family is the Retroviridae, genus is lentivirus. So the structure itself, and also on the top right, you'll see a picture of the structure. So it's 2 copies of single-stranded enveloped positive sense RNA virus. It's an enveloped icosahedral virus, also otherwise referred to as spherical shape. And the glycoprotein complex that it has is the GP120 and 3 stems of GP41. And on the picture on the top right, you can actually see it at the very top on the glycoprotein complex. And then those little buds are all encircled around the virus. And those are the glycoprotein complexes. And next slide, please.
Okay, so for the environment that HIV is found, so in cellular environment, HIV is found in semen, vaginal secretions, blood, as well as breast milk, and it also can transverse transplacentally, so it can cross the placental barrier. Some myths to dispel about HIV is not transmissible through tears, sweat, or saliva, or feces. Those are not risks. Those do not pose risks for HIV transmission. Additionally, HIV is not viable outside of the host, so airborne as well as waterborne or fomite transmission is not possible with HIV. And it's also not transmissible through food. Next slide. Okay. In terms of external environmental factors, so originally HIV was actually discovered in Central and Western Africa in chimpanzees. It's related to the SIV, so the simian immunodeficiency virus. There's a number of different environmental factors that influence the incidence of and influence and development of HIV and AIDS. So rural environments are more likely to have actually HIV progress into AIDS. And urban environments are actually more likely to have a higher load of HIV cases. This is kind of due to the structure of the environments themselves. So rural environments tend to have less accessibility to healthcare services and preventative healthcare. And so there's less testing and less monitoring of HIV. And so unfortunately, many of these people within these areas go untreated and progress into AIDS. Urban environments are more likely to are higher risk areas for transmission of HIV, simply because of the higher concentration of people, mobility of sexually active people that can transmit the virus. Additionally, for other environmental factors, you have socioeconomic status, as well as occupational factors that influence the environment where HIV develops. So poorer areas tend to have a greater disease burden for both HIV and AIDS. This is due to lower treatment as well as lower adherence to treatment, lower preventative services in these areas. Additionally, higher risk behaviors occur with certain occupations. So for drug abuse, sex work, and for drug abuse, there's a needle sharing, and sex work, there's unprotected sex, and then homelessness, there's both that are prevalent. So all of those can are modifying factors that can cause the prevalence of HIV to be higher in certain areas. So this is a particular concern for urban poor areas where healthcare services are limited, and HIV transmission is more prevalent due to these factors. I did look into a little bit of the temporal factors. So interestingly, mortality and risk for hospitalization in the US for HIV related causes is actually higher during flu season. This is they actually found that it was due to pneumonia and influenza. So as Skylar mentioned before, HIV compromises the immune system. So HIV patients are more susceptible to respiratory infections, and so there's a greater risk for hospitalization and mortality during the peaks in these flu seasons. Next slide.
All right, and now I'll be talking about the symptomatology. Next slide. All right, so I'm gonna be talking about the course of illness, and so for HIV, it specifically has three stages of illness, and they're listed chronologically. So the first one's gonna be acute HIV infection. This actually develops 2 to 4 weeks after the initial infection, and most people exhibit flu-like symptoms. And then I'll be discussing symptoms on another slide after this. And then in the acute HIV infection stage, HIV rapidly mutates or multiplies, and attacks CD4 cells. And then HIV levels are very high during this stage. And so at this stage is when there's an increased risk of HIV transmission. The next stage is chronic HIV infection, otherwise known as asymptomatic HIV infection or clinical latency. So the virus is still multiplying, but it's at very low levels. And these people who are in this stage actually don't really exhibit HIV-related symptoms. But without treatment for these people, they'll actually be going into AIDS in about greater than 10 years. And but some people can progress faster. And then last stage is the end stage, which is AIDS, which is severe damage to the immune system, meaning that there's less than 200 CD4 cells. And that also leads to a high risk for opportunistic infections. And so opportunistic infections, the definition that is infections and infection-related cancers that occur more frequently or are more severe in people with weakened immune systems than in people with healthy immune systems. And people without treatment will survive for 3 years when they're at the stage. And another thing I want to mention is that people who are taking ART may be in this stage or in the chronic HIV stage for several decades. And then even though you can still transmit HIV to others during the chronic HIV stage, people who are taking ART exactly as prescribed can maintain an undetectable viral load and effectively have no risk of transmitting HIV to an HIV negative partner through sex or any other means. All right, and then next slide. Thank you. And so this is just a picture diagram of what I talked about in the last slide. And yeah, so next slide. And so for this slide, it's going to be talking about the symptoms, as I said before. So for acute HIV, I said that it was flu-like symptoms. So you'll see fever, chills, rash, night sweats, fatigue, swollen lymph nodes, mouth ulcers, and sore throat as common symptoms. And then for late HIV or in AIDS, you'll see recurring fever, night sweats, extreme and unexplained fatigue, prolonged swelling of lymph nodes, especially in the armpit, groin, and or neck area. Diarrhea for more than a week, sores around the anus, mouth, and genitals, pneumonia, rapid weight loss, memory loss, depression, and then purple, brown, red, pink blotches under or around or on the skin. And next slide, please. And then this is another diagram just showing the main symptoms of acute HIV infections. And then next slide. And then these are just a couple of pictures posted for just what HIV symptoms could look like. These are more so in the early stages. So on the top left, you'll see those, on the top left, you'll see the spots when I talked about the late HIV symptoms. In the middle is just a regular picture of the AIDS virus. And then the top right is the swollen lymph nodes, and then the mouth ulcers on the bottom right. And then next slide. Next slide.
Okay. So for diagnosis of HIV, so there are several tests that exist to determine HIV status. In general, what I want you to get from this is that essentially you do take a blood test. They conduct an ELISA to see if you have the antibodies for HIV, and then they will do a secondary test to confirm the presence of HIV. So oftentimes this is what's called a NAT test. So, or essentially it's an RNA PCR test. So they're looking to see if the genetic material of HIV is present, which would confirm that you do indeed have HIV. Next slide, please. And then for confirmation of, or to determine if the patient has AIDS or progressed to AIDS. Wait, hold on, sorry, never mind. Sorry. So for diagnostics, there is an eclipse period. So the eclipse period is the time between initial infection or initial exposure to the virus, and then to the time where the test can detect this. It's important to note that during this period, infection and transmission can still occur. So just because the patient tests negative initially does not necessarily mean they're negative. A secondary test should be administered to confirm this. So during the eclipse period, it's important to avoid sex, breastfeeding, donating blood products, etc., to minimize the risk of transmission during this period. Additionally, during this eclipse period, the patient may be asymptomatic. And furthermore, they actually may be asymptomatic for years and still carry the HIV virus, which is why it's important to get routine testing for this, for HIV. So as you can see by the first graph, it may take several days to a couple of weeks before tests can detect the presence of HIV. And then the second picture, you can kind of see how HIV transitions from a resting phase to active phases. So, and the virus can actually stay in these resting asymptomatic phases where it's multiplying in your system, where you don't even know it, but you can actually still transmit it. So next slide, please. So diagnosis for AIDS, it's quite simple. So they do a CD4 count using flow cytometry. Essentially, it's a counting system where they count your CD4 cells to determine your criteria for immunocompromise. So generally, normal range is 500 to 1500, and AIDS criteria, as Skylar mentioned, is 200 or less. Next slide. So from an epidemiological standpoint, I wanted to kind of show you what the country as a whole has done in terms of interventions and prevention of HIV. So the HIV and AIDS pandemic began in the late 70s. Since that period, more than 700,000 people have died in the US. So some of the efforts that the US government actually implemented was they developed the first ELISA test to detect HIV, so that HIV patients could be screened earlier. Additionally, they created, in 1985, there was actually a child called Ryan White. He was actually one of the first children to acquire HIV via blood transfusion. And so since then, various screening methods have been implemented in the blood transfusion and donation process in order to prevent HIV being transmitted via blood transfusions. Additionally, that actually led to the Ryan White program. So it's a registry that actually collects data on HIV and AIDS statistics throughout the US and uses that data to allocate funding through various local and state clinics and providers in order to fund HIV preventative services as well as treatment services. Additionally, there was several campaigns that were done to mitigate the spread of HIV. So for instance, ARDA, it was an educational program designed to educate Americans about the myths and how to prevent HIV also. And then additionally, there was an expansion of ACA, so the Affordable Care Act, to actually mandate the coverage of PEP and PrEP, which I'll get into in a second, as preventatives for HIV. And there was also actually additional funding allocated to the Ryan White program in order for further preventative to support further preventative services of HIV. Okay, next slide, please. Okay, so in terms of prevention, there's several different ways. So as you probably already heard of these, barrier methods, so male and female condoms, behavioral prevention, so abstinence, reducing sexual partners, regular testing, knowing your status, as well as your partner status, as well as patient education, and pharmacological intervention. This is one of the most important. So getting PEP, so post-exposure prophylaxis, and PrEP, so pre-exposure prophylaxis, so Truvada. These are both important for preventing a person acquiring HIV. So both of these drugs help prevent the virus from multiplying in your body and destroying your CD4s. Next slide, please. Next slide.
Okay, wait.
Is it moving?
I just lost the page. Give me a second.
Is it not going through?
Okay, let me stop it and share it again.
Okay. Did your thing freeze? My computer's like freezing. Yeah. I have like a million tabs open. Okay.
Oh, here it is. Yeah. Okay, wait.
You got it? Let me know when you're ready.
It says we only have like 6 minutes left to do this Zoom.
What?
Yeah, I can like buy a premium membership and then it'll give us more time.
How? Oh
I
shit.
think I'll just do that.
All right.
I think.
Can we Venmo?
I mean, I didn't even know that was a thing.
I didn't know that was a thing either. I didn't know there was a time limit.
Let's try to beat the time first before we.
Okay. We have 6 minutes. Okay. I think I can do that. How much do we have? We have a lot. Okay. I'm sorry. I put too much.
Okay, we're almost done.
Yeah, slide 19. Are you ready?
Oh, yeah.
It's the next one. Okay. So for the general approach to treating HIV is, as Skylar mentioned, is antiretroviral therapy, so ART therapy. The goal is to reduce viral load to maintain undetectable status, and by doing so, reduce likelihood of transmission. Additionally, routine evaluations, so includes physical checkups as well as blood tests for CD4 levels. Next slide. So in terms of nursing considerations, I do want you to consider that HIV is a manageable disease. Actually, as of 2017, a study that I looked at was actually showing how the lifespan of a person with HIV adherent to ART therapy is actually comparable to someone who is not, who does not have HIV. So it's very big improvement, considering that when HIV first started, the average lifespan or the mortality age was actually about 39. So very big epidemiological feat. So something I do want you to consider as nurses is have your patient work closely with and see a provider regularly. Ensure that they're taking their ARTs. Adherence is a big problem in HIV with HIV patients, simply because they do have to take them every day. Otherwise, it risks losing effectivity, as well as it can create resistance. Additionally, obtaining home health medication lists, because some medications actually do interfere with the ART regimen, as well as avoid patient judgment and blame, and encourage the patient to ask questions so that they can further understand their treatments and better adhere to anything that you provide for them. Okay. And then I just wanted to show this graph to show you how treatment for HIV has come a long way. So the life expectancy for a person with HIV has increased dramatically since the AIDS crisis in the 70s. So in the 70s, the average person with HIV only lived to about 39. Today, a person taking ART is actually has a comparable lifespan to someone who does not have HIV. So very big accomplishment. Next. See you.
Okay, excuse me for if it's fast, but because we have 3 minutes left on the clock, I'll just talk about the disease distribution. 37.7 million people were living with AIDS in 2020, with estimated 1.5 million individuals that acquired it. And this was a 31% decline in new HIV infections since 2010. And 1.3 million of these new HIV cases were aged 15 and above, and 160,000 were children aged 0 to 14. In total, 79.3 million people have been infected since the start of the epidemic. 36.3 million people have died from AIDS since the beginning of the epidemic. And there are 16% that aren't aware of their HIV status, and only 73% had access to the antiretroviral therapy. 66% were virally suppressed, and 28.2 million people with HIV were the 73% accessing ARTs, and 9.5 million people await treatment. So, people who are at risk for HIV include pregnant women, and they need to protect themselves from vertical transmission of HIV to their children by receiving ARTs. And in 2020, 680,000 people died from AIDS-related illness, compared to 1.3 million in 2010. And in the US, there were about 1.2 million people who had HIV by the end of 2019, with 30,000 people receiving an HIV diagnosis. At-risk groups include male-to-male partnerships, and which contributes to 68%. And ethnic groups that are at risk are African American people. And young people are at risk too. In the US, the South had the highest number of people living with HIV, and the Northeast had the highest rates of people living with HIV. Over the past decades, there have been many medical advances and scientific knowledge of HIV and its prevention and treatment. There have been significant efforts made by global health communities, leading government and civil organizations, such as UNAIDS, which is the leading organization to stop HIV and spread knowledge of its prevention. And yet there's still many people with HIV are at risk for HIV that do not have access to prevention, care, and treatment. Many disparities in race, sexuality, and geographical distribution. And there's no cure. People need treatment and access to ARTS, antiretroviral therapy. And with the right amount of, with the wide selection of HIV prevention tools and massive scale up throughout the years, global organizations such as UNAIDS can warn of unequal health disparities to treat HIV and end AIDS-related deaths. And it's really important that we prevent the spread of discrimination and become aware of stigma associated with diagnosis of HIV. And in the future, we must combat the social inequalities and exclusion of people who are diagnosed with HIV, because they are major health barriers to positive outcomes. And here are our references.